of the day for us right here in the CNN Newsroom.
Online healthcare, there is a wealth of information, that's for sure. But how do you find what's right and right for you specifically? Steve Case has some answers to these questions with his new venture, RevolutionHealth.com. He is the co-founder of AOL and former chairman of CNN's parent company. Steve Case, nice to see you this morning.
It's good to be here.
Hey, I want to just ask you right off the top here. We know that we are having this internet health fair that people can go to and find all sorts of different information. What is the need for something like this?
Well, there's all kinds of information out there on the internet, health information, but it's never really been organized in a way that people can really understand it. And that's what we're trying to do with RevolutionHealth.com. And this week we launched the first online health fair. There you have health fairs in community centers. Sometimes company has them. They have different organizations come in to talk about different conditions, whether it be asthma or celiac or cancer or what have you. We decided to do it all online in partnership with about a dozen different organizations this week. It's very exciting.
I remember that when different websites came out years ago now, and people were kind of flocking to them, trying to get their information about different health situations that might be going through, instead of having to go to the doctor. But there were problems with that, a lot of misinformation. Why is this better?
Well, there's no replacement to go to a doctor. Ultimately, a doctor has to make a diagnosis. But there is a lot of information out there, I mentioned, that could be organized better. I used to say in the early days of AOL it was a mix of content and context and community. And when it comes to health, there's a lot of content out there, but there's not a lot of context and community. That's what we're trying to address with RevolutionHealth.com. One site with the best trusted brands, advice from Mayo Clinic or Cleveland Clinic, married with the best social networking tools, sort of what MySpace and Facebook do for your kids, we're trying to do for health, and also a whole degree of personalization so you really can track your health. You can track your stock portfolio online, you can track your friends on your buddy list online. We think you should track your family's health online, so that's another aspect of it. So it's all the best parts of the internet in one place, which is what RevolutionHealth.com is all about, and it's free.
All right, let's take an example then. Obviously, I'm going to ask you about celiac disease. People here probably know I work with the National Foundation for Celiac Awareness. With our disease, that is the problem. It's awareness. So many people have this disease but have absolutely no idea that they may have it. So what happens if I go onto the internet health fair site and I am looking up specific questions about, there it is, the NFCA. How do I navigate this? What do I do?
Well, that's an example, because with celiac, a lot of people do have it but don't really know it. So if you have some recurring problems with your stomach, or perhaps migraines or other things, perhaps it's celiac. And if you go to RevolutionHealth.com and type on our health fair and type on the celiac logo, there's a number of resources there, including a symptom checker that will allow you to answer a number of questions, and that will give you a sense of whether perhaps it is celiac, in which case you should see a doctor and really have it more fully diagnosed. But it's a quick way to understand if something's been bothering you, particularly if it's been bothering you for weeks or months. In some cases, celiac bothers people for years before it gets diagnosed. We're trying to address that with RevolutionHealth.com, and particularly with the health fair we launched this week.
So this is really, it should be seen, and worth mentioning once again, that this is seen as something that you go online, you get preliminary information, or you get a few of the basic questions answered about whatever you may be feeling, if you're feeling kind of lousy, and then go on to your doctor to talk about it.
Yeah, absolutely. What we try to do is take the best resources out there and put them in one place, because there is a lot of, as you mentioned, a lot of misinformation on the internet. If you type in diabetes on Google, you'll probably get 100 million hits back, some of which is useful, some of which maybe is not useful, some of which is accurate, some of it's maybe not accurate. So what we're trying to do with RevolutionHealth.com is provide some context and some simplicity, and then allow you to meet other people who may share that particular cause or suffer from that particular disease. So it's a mix of content and context and community, all at RevolutionHealth.com.
It looks pretty easy too. I have not done it yet, but I have been on the site a little bit. I just haven't navigated around, but we're watching that go on right now.
Well, it's a benefit of starting something new. That we just been working on this for the last couple of years. We launched RevolutionHealth.com just 2 months ago. It's already one of the top 10 health sites out of thousands, but we're gunning to be the #1 site, because my whole focus here, the reason I am spending so much time and investing so much money in this, I think healthcare in this country is screwed up. Consumers need to take more control of their family's health, but they need tools to do that, and that starts with RevolutionHealth.com. We really want to revolutionize healthcare, put the power back in the patient's hand, and really gives them the tools to manage and control their family's health. And that's all what we've been working on so hard for the last couple of years.
And I know you're speaking to a lot of people's hearts when you say that. In fact, you had a personal experience in your family of getting a lot of misinformation.
Correct. My brother Dan was diagnosed with a brain tumor about 6 years ago, passed away unfortunately about 5 years ago, and just as our family dealt with that, trying to understand the disease, understand what the options are, it was very confusing, very bewildering, and frankly quite scary. And I just decided that I needed to make a contribution. I spent 20 years trying to make the internet accessible through AOL. I'm going to spend the next 20 years trying to make the healthcare system more accessible and more consumer-centric. And it starts with revolutionhealth.com.
All right, and the Internet Health Fair going on through the end of the month. Steve Case, we certainly appreciate your time here today. Thank you so much.
Thank you very much.
And we're just moments away from